Go live now.
Good afternoon, everyone. My name is Harisha Gajam, and I am working as a product executive in the marketing department of Hetero Healthcare. On behalf of Hetero Healthcare, I would like to welcome you all to this webinar on HIV and Aging Challenge. Before we proceed with the scientific agenda, I take this opportunity to brief on Hetero Healthcare, which has been a strong partner with HIV experts across the globe. We mark more than 25 years of our journey in HIV management. It started with the beginning of manufacturing and exporting of APIs and finished formulations of antiretroviral drugs. Today, Hetero Healthcare supplies 1/3 of the global requirement of antiretrovirals. Apart from HIV, Hetero was majorly involved in tackling the national emergencies such as swine flu in 2005, as latest as COVID-19 epidemic. This was possible only due to strong R&D team and state-of-art manufacturing facilities. 5th June is HIV Long-Term Survivors Day, which reminisces the long-term survivors of the epidemic and raise awareness of their needs, challenges, and journeys. So the goal is to prioritize on improving the quality of long-term survivors and older adults. To discuss this further in detail, I would like to invite our speaker, Dr. Neha Gupta, is from the first batch of qualified infectious disease specialists in India. She has a global experience in diagnosis and management of fever and infectious across various specialties. Dr. Neha also received a certificate of achievement from Johns Hopkins University, USA. Currently practicing as an infectious disease physician at Fortis Memorial Research Institute, and she is also a founder of NG Swastha Infectious Disease Clinic at Gurgaon. She is also promoting awareness of infectious disease among various specialties and supporting infectious disease in various institutions, contributed as an ID specialist, as faculties for various national conferences of various specialties, invited for more than 100 invitational lectures across local and national platforms. Dr. Neha has received various awards for her recognition and contribution in the field of infectious diseases. With this, I would like to hand over the session to you, ma'am. Over to you, ma'am.
Thank you, Harisha. Thank you so much to Hetero Healthcare also for giving me this platform. And I'm really thrilled and excited to discuss the session. So we are going to discuss aging with HIV. And see, for a long period of time, it was thought that can we afford to treat HIV? But at that time, a more pertinent question was that can we afford not to treat HIV? The questions have evolved over the last 4 decades, and today it is about can a person living with HIV lead a healthy life? And this is what we are going to discuss today. It's important, definitely, the life expectancy is important, but a life which is healthy, which is swasth, is also extremely, extremely important. So in the last 4 decades, there has been staggering advances in the field of HIV medicine. Novel potent combination antiretroviral drugs have transformed HIV from a sure shot death sentence into a chronic manageable condition with a life expectancy approaching that for people living without HIV infection. There has been a dramatic reduction in the AIDS-related morbidity as well as mortality. But with aging, there is a relative increase in the chronic non-AIDS end organ diseases as well as metabolic complications among people living with HIV. And this is going to be the focus today. So when we say people long-term survivors, It's usually people who have HIV infection for a long period of time, and then they are surviving. So in fact, people older than 50 years of age, there is going to be this is like a silver tsunami. And in fact, by this UN AIDS 2014 gap report, 13% of the adults with are going to be more than 50 years of age overall. And then subsequently in the sub-Saharan Africa, more than 2 million people will be more than 50 years of age who are going to live beyond 50 years. So as we can see here, that the number of people living with HIV who are more than 50 years are absolutely going to increase as we are decreasing the life-threatening infections. Here in 2018, 15% of the people living with HIV were more than 50 years of age, and 17% were newly diagnosed with HIV infection. And it is estimated that by 2030, 70% of the people living with HIV will be more than 70 years of more than 50 years of age in Netherlands. So today I'm going to discuss on impact of HIV on aging. What are the metabolic concerns in people living with HIV? Are there any side effects of the medications, the various metabolic complications, and also focus on the polypharmacy as well as the various comorbidities, and discuss briefly on the prevention of infections as the people are becoming older and older. So let's take up the first one, and we are going to start with the impact of aging as well as HIV on the brain. So this was in fact one of my first cases which we had seen with HIV infection, and the patient had presented with movement disorder. And we had the opportunity to publish this in 2009, and it was under my training under Dr. Rajiv Soman sir. So as we all know that HIV-associated neurological disorder persists in close to 30% to 50% of the people living with HIV, and it causes cognitive, behavioral, as well as motor deficits, and even when ART keeps the virus under control. So what happens is that in HIV, it does not directly affect the neurons. It has an indirect effect on the neurons. It binds to the CD4 positive. This is the HIV virus, which is binding to the CD4 positive T cells as well as the monocytes. In turn, there occurs release of certain toxic cytokines, which cause damage to the oligodendrocytes, resulting in decrease in the myelin formation. And that is how the brain or the CNS gets affected. Here it's basically which results in a cerebral volume loss. And there is a certain paradox which happens in the HIV infection, and this is a central paradox that as such, the antiretroviral therapy has a limited penetration into the blood-brain barrier. However, the HIV virus binds to the CD4 positive cells, and then this infected leukocytes, they can easily cross the blood-brain barrier. So the virus at times keeps on multiplying within the brain as there is a limited penetration by certain antiretroviral drugs. So there may be chronic as well as persistent replication, which may continue despite a very low viral load. This increases the risk of the various neurological, metabolic, cardiovascular, as well as the cerebrovascular comorbidities and resistance in the CNS, which may in fact evolve discordantly. So the serum viral load may be completely undetectable, but there may be persistent viral replication which may happen, and that is why it's very important that the choice of antiretroviral therapy with good penetration into the brain as well is extremely important. So HIV virus definitely has an impact on the mental health. A lot of people living with HIV have mental health problems, and besides this, there is also it's not just the younger population, but as the age advances, problems related to depression, social isolation, and sometimes loneliness and rejection, in fact, become much more predominant. So when we look at this is one of the second annual stage of aging with the HIV National Survey Mental Health. And they have mentioned that 39% of the people who are diagnosed with HIV, in fact, have some mental health conditions. Sometimes they also have some stress disorder. Now, as the age advances, there is a strong possibility of memory loss also, which can happen, which sometimes, as per this national survey, it is around 50 or 60% of the individuals may feel that. And usually, what happens is, it's basically like, that is, they 32% went with when they don't interact with somebody, which happens when you're elderly and you're lonely, then the problems are even more. So that is why, I mean, all this is there. But when we look at the antiretroviral therapy, it's very important that we use drugs which have got good penetration into the brain. And that's where there is a concept of the CPE score as well. And the concept is that the drugs which have got a high CPE score have got a high CNS penetration, and drugs which have got a low CPE score have a low CNS penetration. And that is why it is the good part is that currently the drugs which are being used, or which are the A1 recommendations, that is the integrase inhibitors, they are the ones which have got a good penetration or a high CPE score as well. Now, the second concern especially the medical comorbidities, what are the various side effects as well as the metabolic complication of the antiretroviral drugs, and what is the interaction of the antiretroviral drugs with the drugs which are used for the other comorbidities. So we are going to focus on the polypharmacy as well here. Now, we all know that India is the diabetic capital of the world. As the age is advancing, that is, more and more people are going to be affected with diabetes, and it is projected that by 2030, close to 100 million people in India will be diabetic. Now, when you are taking anti-diabetic medications, or when a person is on diabetes and the patient is also taking antiretroviral drugs for the HIV infection, there is some interaction, there is a metabolic side effect which can happen, and it's very important that the diabetes is kept under control, because sometimes ARV can increase the blood glucose levels, and on this the diabetes can also develop. So lifestyle modification, a control on the diet, a good exercise is extremely important, and it's very important to adhere to certain basic principles of the good healthy lifestyle. Now, when we're taking antiretroviral drugs, there are certain side effects which can happen. One is related to the bone, and one is also related to the kidneys, besides the metabolic complications related to the sugar, cholesterol, as well as impact on the liver. And now I'm just going to discuss regarding this 52-year-old lady who has been a long-term survivor. She has been on TDF, FTC, and atazanavir, ritonavir since 2012. And then later on, she started having, she was complaining of pain in the legs as well as the hands. The creatinine was fine. The CD4 was 727, and the HIV viral load was completely under control. It was fully suppressed. And she was found to have vitamin D deficiency. But at this point, when the patient is on TDF and the FTC, we also went ahead for a bone mineral density, which was done, and it showed that it is suggestive of osteopenia. When we do a BMD, it's not really necessarily that we do the entire BMD, but a L3, L4, and left femur. And when it is done, basically for 3 days, the calcium as well as the other vitamin D supplements should be stopped. When it showed osteopenia, what do we do? Basically, and why has it happened? Is it because this is an elderly female, or is it also somewhere related to the antiretroviral drugs here? So TAF and TDF. So when we, this lady has been on TDF, whereas nowadays more and more we are using TAF as well. This is tenofovir ralafenamide, which is basically a prodrug of the TFE. So here the TFE is basically the tenofovir. Now TDF stands for the tenofovir disoproxil fumarate, which is 300 milligrams. It has a very short plasma half-life, and within the plasma, it gets it is from here, it goes into the renal tubular cells, and that is responsible also for the nephrotoxicity. Whereas the prodrug is the tenofovir alafenamide, which is available as usually 25 milligrams. And it has a very long plasma half-life. It has a greater plasma stability, and then it crosses the plasma and achieves a very high concentration within the lymphocytes. So a higher concentration in the lymphocytes is achieved by the tenofovir when TAF is being used. And since it has a greater plasma stability, more than 90%, there is very low concentration of the drug, which is presented to the renal tubular cells. And that is why this is responsible for a lesser nephrotoxicity. And also the advantage of the tenofovir is related to the bone and mineral side effects, that TAF, as compared to the TDF, is associated with the lower bone-related side effects as well. But however, there is a little problem with TAF also, that this is associated with a higher weight gain as well as higher lipid levels as compared to the lower lipid levels which are seen with the TDF. So there has to be some balance when we are choosing drugs for our patients. In long-term survivors who are on TDF, and if suppose there is kidney or even bone-related toxicities which is developing, then of course we need to change or switch the drug from TDF to TAF, or even abacavir hypersensitivity test can be performed, and we can go for the abacavir based regime as well, provided the patient is has not failed prior, plus hepatitis B is negative, and also there is no cirrhosis or a chronic liver disease. When we look at the TAF based regime, TAF does not really require a renal dose modification until the creatinine clearance is more than 50, whereas renal dose modifications are required with TDF with a creat clearance of less than 50. There is interaction of TDF, there is no interaction of rifampicin, which is an anti-TB medication with the TDF, but there is some interaction of rifampicin with the TAF. However, it can still be used in the same dosages without having any dose modifications. Now, this is one of the slides which demonstrates the bone mineral density changes which occur when we are switching from TDF to a TAF containing regimes. As we can see here, the TAF FTC is in red here, and the green is TDF FTC. So the bone, when there is a switch from TDF FTC to TAF FTC, there over a period of time, there is definitely an increase in the bone mineral density, which has been shown. So this is one of the side effects which one has to keep in mind once the patient is on a TDF-based regime. A regular examination with BMD, L3, L4, vitamin D, vitamin B12 is very, very important. Now, besides this, when we also have, when a patient is on antiretroviral therapy, it's important that regular tests related to creatinine as well as liver function is also performed. This is because there is a association of the non-alcoholic fatty liver disease, which is very much prevalent in people living with HIV. And in fact, as such, the HIV virus here directly affects the changes in the liver. It induces a hepatocyte apoptosis and also has an effect on the gut microbiome, promoting the microbial translocation as well as ultimately accelerating the chronic inflammation. There are also some dysregulated immune function, and sometimes there may be associated co-infections like hepatitis B as well as hepatitis C. Besides the ART, which is the antiretroviral therapy, especially say sometimes PIs or some integrase inhibitors, with this one has to be careful and do regular monitoring of the liver function test as well. Also, metabolic side effects like diabetes, obesity, dyslipidemia can also occur over a long period of time, and this can impact the liver. So that is why in people living with HIV, one also has to be a little careful about the liver also, not because of the alcohol, but because of the associated non-alcoholic fatty liver diseases. There are certain other health issues which occur as a patient as age advances in patients living with HIV. So there is also polypharmacy. That is, we've just seen that there are a lot of people who may have diabetes, they may have cholesterol. Also, there is other comorbidities which can be there. So there are multiple comorbidities, and in the very advanced age, there is of course frailty issue which one has to be more careful about. Besides this, the psychosocial mental health always is underestimated or given lesser importance, but it is extremely important, and that is why a support is definitely needed even when they are aging. So I think in India, and especially I think in my practice, I would say 80% of the patients, elderly patients, are kind of supported by their family, which is a good thing. This may not be so much true in US, but at least in our practice, we are seeing this. A lot of elderly patients who are detected newly at age, they may want to not really come out with it because of the stigma associated, but close to 80% of the population is well supported by their family members. And it's very important because support in any form will help in improving the mental health. It will definitely avoid the loneliness, and the social support systems are extremely important. So when we have different comorbidities, there is a concept of polypharmacy, which is giving more than 5 medications, and increased medication use is associated with sometimes decreased adherence as well as increased pill fatigue, because most of the patients do not want to keep on popping pills. There is increased risk of some adverse drug effects as well as drug-to-drug interactions. That is, the antiretroviral drug may just interact with the other drugs which are being used for the other comorbidities. For example, there is an interaction of metformin with the integrase inhibitors, and the dose of the metformin should not be more than 1 grams per day. This is drug-to-drug interaction, which we all should be very, very careful about. Then, of course, there are certain geriatric syndromes which one has to keep in mind. So, when we look at the polypharmacy, it is one of the strongest predictors of serious adverse effects, and all this may be associated with a higher increase in the mortality as well. Now, what is this multimorbidity? That more common in older people living with HIV because of the intersection of the various diseases, lifestyle, risk factors, polypharmacy, chronic inflammation, immune activation. There are multiple comorbid conditions. All this increases the mortality as well as the frailty. And it's very important that we have a holistic approach to it, because it's just that all this together, the whole is definitely much more greater than the sum of its part. And it's important to look into, take care that lesser and lesser medications are given, as well as all the comorbid conditions are also tackled properly. So when we are looking at applying the best practices for people who are living with HIV, it's important to address the polypharmacy as well as the multiple morbidities, as well as the frailty, which is important. So for the doctor as well as the patient, it's very important to look into the medications review. They have to be reviewed at every visit. We need to ask whether we really need to give this medication to the patient, or just one drug or one pill, which is the antiretroviral therapy, is sufficient for taking care of all the problems. And of course, sometimes we have to take care of the other multivitamins. They have to be appropriate, but more and more focus even on the daily health. Their diet, exercise is extremely important. So when a patient comes for a follow-up, we have to check for the various medications, review the various drug-to-drug interactions. Is there any? This, for example, the integrase inhibitors and the metformin, because a lot of people may be having diabetes, discontinue the various unnecessary medications, simplify the regime as much as possible. For example, if the patient is on antiretroviral therapy, instead of giving, say, TDF, FTC separately and bictegravir or other integrase inhibitor separately, we can actually combine this as just one single pill, and this will definitely help in improving the compliance. Then we also have, we need to consider any adverse drug effects or any for any potential new syndrome which is developing. Any new symptom or syndrome, look at whether this can be because of the adverse drug reaction of any of the drugs which the patient is on. And at the same time, whatever drugs are being prescribed, they have to be prescribed in the appropriate dosing. Now, when we talk about multiple morbidities, then it's very important to plan appropriately, manage them with, say, suppose with the various other specialties, which includes endocrinologist or even neurologist or even orthopedics. So every specialty, there has to be a collaboration and a close coordination. And it's very important to prevent infections with the help of vaccinations. So a patient who's more than 50 years of age, it's important to screen every 1 to 2 years for any frailty as well as the other comorbidities. It's important to address several modifiable factors like smoking, etc. And also focus on the diet as well as exercise. A regular walking of 30 minutes at least should be done in the morning as well as evening. And a comprehensive geriatric assessment is also extremely important. We must take care that there are certain medications which may have a little higher impact on the liver. And that is why, of course, we are not using the older antiretroviral drugs. We are more and more using the newer generation. And in this, we have to take care about, like, say, the boosted PI as well as sometimes the integrase inhibitors, although they are very, very liver safe, but one has to be just careful about the metabolic side effects, and careful monitoring of the liver is, or the SGOT, SGPT, and the liver function test is important. Now, let's shift the spotlight on the older women who are living or aging with HIV. And they also face several problems like the menopause. There may be some neurocognitive decline, like problems related to loneliness, mental health issues, and also more and more stigma is also, at times affects them. There is a risk of cervical cancer, so that's why regular screening, pap smear is also extremely important. As age advances, because of the hormonal disturbances, more and more females are affected or more prone for osteopenias and osteoporosis, and this is definitely more in case of women who are living with HIV. So this needs to be addressed as well. And again, mentally, everybody needs the support. Now I will go on to the prevention. See, even when we are not living with HIV, as our age advances, there is immunosenescence. That is, the antibodies which are produced, or our immunity goes down. And this predisposes to various infections like the pneumonia or influenza, or there are several other infections which our body gets prone to. This also happens in a person who's living with HIV. So people with HIV, as age advances and they are becoming, or they are going into the bracket of more than 50 years of age, they are more prone for infections. And now we have effective vaccinations for prevention of infection in this subgroup population as well. So the first and one of the most common infections which we can prevent is the pneumococcal infections. And this is caused by a bacteria, which is a Streptococcus pneumoniae. This is a bacteria which is commonly present in the nasopharynx of 60% of the community. And at this time, it is asymptomatic. But whenever the immunity goes down, it can result in infections involving the ear, the sinuses, the pneumonia, and sometimes bacteremia, and also cause damage to the heart or affect the heart. So there are several factors which are responsible for the pneumococcal infection, and this includes if there is some defect in the antibodies, neutrophils as in patients with diabetes, alcohol, complement, if there is a defective clearance of pneumococcal bacteremia, which can happen if the spleen is not functioning properly, or if there's a prior respiratory infection. So as we can see here, this HIV infection is also one of the important risk factors for pneumococcal infection. And the pneumococcal diseases, as I've just mentioned, causes the non-invasive disease which occurs via contiguous spread. It is responsible for sinusitis, otitis media, as well as for the pneumonia. Whereas if there is infection, that is an invasive disease which is via the bloodstream, it can result in severe sepsis, severe infection, ICU admissions. It can affect the brain, infection of the brain, which is meningitis, and of course, bacteremic pneumonias, and also affect the virus part. So now we have effective vaccination for prevention of infections, and I would like to describe this with the help of this video. This is on our channel, which is NG Swastha, capital N, capital G, space Swastha. And here we are going to just describe it on this. Yeah, hi. So, when we talk about vaccination in the HIV patients, few vaccines, which includes the pneumococcal vaccine, influenza vaccination, hepatitis B, TD, which is tetanus and acellular pertussis vaccine, that should also be given every 10 years, and the vaccine for shingles. These are very useful and effective vaccinations which are recommended for people who are living with HIV as they are growing older. Even the caregivers, for example, if they have young population children as well as their children, they should also try and get vaccinated. Why? Because once it's about covering the entire circle and protecting the elderly people who are living with HIV infection. So this is also one of the very effective ways and strategies for prevention of infections. Um, Yeah. So this is what it is: the influenza, hepatitis B, as well as the TD vaccine. And varicella vaccine obviously cannot be given in people living with HIV because it is a live attenuated vaccine. Only killed vaccines are to be given for the HIV patients. So to summarize, basically, um, in today's world, definitely the treatment focus has shifted from just CD4 and viral load to assessing the other comorbid conditions. And it has definitely shifted to non-AIDS complications such as the cardiovascular morbidity, dyslipidemia, the diabetes, insulin resistance, the loss of bone density, the liver, kidney related problems, and also keeping in mind the various non-AIDS malignancies. So that is why regular pap smear, etc., becomes much more important. And it's very important for us clinicians to be well versed even with the basic concepts of the internal medicine to effectively manage these challenges. So all infectious diseases, all doctors who are treating the people living with HIV should have a wholesome or a holistic approach as well, and regular monitoring is definitely needed to pick up these complications as early as possible. So, as I began with that earlier, the most pertinent question was, can people with HIV live long? But right now it is that, can people living with HIV live a long, healthy life? And this is what is very important. It's important to have a healthy, swasth life. Thank you so much.
Yes, ma'am. Ma'am, can we just move to the question and answer?
Yes, of course, Harisha, we can.
Yeah, sure. Ma'am, the question is, when person is on antiretroviral therapy, can he or she transmit HIV virus to others?
Okay, so there is a concept of U is equal to U, which is when you are undetectable, there is you are untransmissible as well. What it means is when an HIV viral load is undetectable, that it is less than 40 or it is less than 20. So then the risk of transmission is almost nil. So this has been established in the various studies that undetectable is when a person is not having HIV infection, the viral load is not detected, then they cannot transmit the HIV infection. But having said that, it's very important that we follow all the safe sexual practices.
Okay, ma'am. Next question is, how long do we need to take the medicines?
The medication is a lifelong medication. For HIV infection, we still do not have cure. We have medications which can completely suppress the virus load. So the virus is completely suppressed and it is controlled, but it is there. So the medication currently is lifelong medication. There may be more and more advances which may happen, but we have to wait for them.
Okay, ma'am. Next question is, when HIV patient having vitiligo problem, can he will take vitiligo drug and exposed to UV radiation?
Yes, yes, that is there. Yes, there is no interaction as such.
Okay, ma'am. Next question is, how the aging with HIV affects the person?
So I mentioned that aging with HIV has an impact in terms of like, as first of all, our immunity keeps on going, declines as the age advances. And secondly, patients are taking certain medications. So these medications may have certain side effects which have to be monitored. Although the medications are very safe, and there has been a complete revolution in the field of HIV medicine, that these are very safe, effective medications, but yes, they still require monitoring. And we also, as age advances, there are multiple comorbidities, polypharmacy. That is why the antiretroviral drugs as well as the other medications have to be checked for any drug-to-drug interactions, and vaccination. This is very important for the prevention of infections.
Okay, ma'am. Next question is, how can one deal with extreme fatigue?
So first of all, we have to find, this is one of the important things which can happen in people living with HIV as more, as they're living longer. There can be multiple causes of fatigue, whether it is because of certain vitamin deficiencies, which we have to rule out. Secondly, is it related to the psychological impact of HIV and the stigma and the various stress associated with that? Like, is it a chronic fatigue syndrome? So we have to find out, but first, what is the cause for it, and then address the exact issue.
Okay, ma'am. The next question is, how many percentage of HIV positive people develops drug resistance?
So with the current integrase inhibitors which have come, the bictegravir, the dolutegravir, the percentage of resistance or the new cases of HIV drug resistance are definitely going down. Even in our clinical practice, this is what we are observing. They have very, very potent drugs as compared to the other regimes which we had earlier, the NNRTI, the efavirenz-based regime. There, the percentage would be somewhere around, say, 6 to 10% as such. But yes, now more and more, the resistant cases are going down. However, HIV virus is a very low fidelity virus. Even when the patient is on therapy, one has to be extremely careful and do regular monitoring of the viral load to detect any kind of deviation or any early change in the resistance pattern, or
Okay, ma'am. The next question is, what can help while dealing with misunderstanding or judgment from family and friends?
What can
help while dealing with misunderstanding or judgment from family and friends?
So I think the best is always conversation with yourself, and conversation with the family members. It's important to be positive, and first, they say get up every morning and choose joy. So similarly, choose positive thoughts in your mind, and with that, think that yes, everything is going to be fine, everything is going to be positive. Henceforth, whatever has happened has happened. I mean, this is more likely a philosophical answer, but this is how I think we need to deal with life. And then also converse with your family members. An honest conversation probably will always help.
Okay, and the next question is, can a person take break from HIV medicine?
No. As long as you're tolerating the medication, one should not skip any single dose. The adherence has to be more than 95%. If the adherence is less, especially when it is between, say, 60 to 90%, the risk of acquiring drug-resistant mutations are very high. That is why the adherence has to be almost 100%. However, just in case, if there is some side effect, which is a serious side effect, it may be sometimes rashes or some other side effect which has happened, then you can stop it for a couple of days under the supervision of your doctor or infectious diseases specialist.
Okay. The next question is, what message would you like to send to younger people living with HIV or people who are newly diagnosed?
So the first important is there are certain do's and don'ts one must remember. that first of all, there is always a shock, even with so much of spread and awareness, there is a shock in the initial first few days. And that is how long can I live? So what first is that, yes, now HIV is no longer a life-threatening infection. It has been converted into a disease like diabetes or any other chronic disease where you take proper medication, appropriate drug, the preferred drugs have to be taken regularly, full adherence with regular monitoring is extremely important. And of course, we have to take care of our partners as well as the prevention of other sexually transmitted diseases is also extremely important. Also remember that we have come into the era of U is equal to U, but that does not prevent from acquiring other sexually transmitted diseases. And that is why one has to be very careful, because HIV and other STDs, especially syphilis, has been coming up with more and more, non-usage of the condom. So it's very important to also follow safe sexual practices. And vaccination also is extremely important.
Okay, ma'am. Ma'am, the next question is, ma'am, if I'm positive and my wife is not, should I disclose it to her? I have fear of being abandoned.
So this is a very personal question. It all depends upon how your relationship is with your wife. But I think it's very to have a good married life henceforth. It's important to be honest as well. So it will depend upon person to person. But if I'm asked, then I'll say yes. It's very important to disclose it to your wife because she is also affected.
Yes. Okay, ma'am. And the next question is, what are the long-term toxicities of the medications?
Yeah. So the long-term toxicities are related to especially the metabolic complications related to sugar. So fasting blood sugar, HbA1c, a serum lipid profile, a liver function test, a creatinine to assess the kidney toxicity, and a bone mineral density, BMD, L3, L4, as well as left femur, to assess any impact on the bones, osteopenia or osteoporosis. These are extremely important, which one must just keep on monitoring at a regular basis.
Okay, ma'am. Ma'am, the next question, what is the impact on treatment adherence?
What is the impact on treatment adherence? I think the first is when a person living with HIV takes HIV medications and it becomes absolutely fine, then a lot of times they may just stop the medication. And then it's later on that multiple problems can arise again. So it's very important that regular medications are taken, and even if you're feeling all right, the medication should not be stopped. As age is advancing, there are other infections, for example, in case of females, urine infection, etc., that can happen. So, I mean, these are also associated with aging, and that can anyways happen with HIV patients who are living longer, who are actually going into that more than 50 years of age. So, one has to be extremely careful with the adherence and take the drug at lifelong without stopping.
Okay, ma'am. The next question is, what is the effect of constantly activated immune system? Does this have effect on accelerated aging?
Correct. Yes, it's a very interesting question. And yes, if there is a constant activated, since there is going to be an accelerated aging as well. But however, it is like if your other factors, your other lifestyle is absolutely under control, like which you can do it with the help of a good control in your diet, good focus on the exercise, etc. One can decrease the biological age, even if you have HIV infection.
Okay. Okay, ma'am. The next question is, if person has developed drug resistance, what are the medications that will help the person with HIV, or strategies, medications or strategies?
So it depends. The drug resistance has been acquired on which antiretroviral therapy. So the prior antiretroviral therapy, if suppose it is an NNRTI based regime, then we can go for a bictegravir, a protein or integrase inhibitor or a protease-based inhibitor. And so it depends upon the prior ARVs which the patient has been taking, and that is how we fashion or choose our drug-resistant regime of the ARV.
Okay, ma'am.
Yeah, so the darunavir, ritonavir, which is definitely like if the viral load is more than 1 lakh, then it will be 600 milligrams. Whereas for once the viral load is fully suppressed, then we can also choose for the 800 milligrams of darunavir. That is also there. But otherwise, if there is a basically, if suppose it is TAF FTC and it's just resistance to NNRTI, then we can use TAF FTC and integrase inhibitor.
Okay, ma'am. Ma'am, the next question. What is the role of nutrition and nutrition supplements in managing HIV?
Very, very important, because there is a wasting syndrome, HIV wasting syndrome, which happens in people living with HIV. So nutrition is extremely important, and a high protein diet is very important aspect of the diet. The protein requirement for a healthy person is 0.8 grams per kg per day. For HIV patient, will be anyways a little higher. So it has to be at least 1 gram per kg per day. So if the person is around 50 kgs or it's 40, whatever, like, and even it's suppose it's 80 kg, so at least 80 grams of protein for 1 gram per kg per day is needed for maintaining the muscle mass, which is lost in people with HIV infection. So as such, diet should have less carbohydrates. Why? Because people tend to put on weight, and especially when they are on antiretroviral drugs. So that's why the carbohydrate needs to be reduced, and a protein intake has to be supplemented, especially in the vegetarians or in India. A lot of people may not be having or taking the adequate protein, which is needed for maintaining good muscle mass. And of course, nutrition wise, it has to be well cooked food, which is needed. Refrigerated food items also can sometimes result in infections like listeria, etc., which can happen in HIV or immunocompromised in immunocompromised patients. Concept of eating 5 fruits a day is extremely important as well. And more often, it should be freshly cut fruits as well as vegetables, which are important. So, and of course, diet is also water. The water intake overall has to be extremely important. So normally they say 35 ml per kg, or in layman terms, we can say that half a glass of water every half an hour if your kidney function test is and your heart condition is appropriate.
Okay, ma'am. Ma'am, the next question is, how can one overcome the isolation and stigma of HIV diagnosis?
So it has to come with support. First is supporting yourself by being, I mean, of course, it has to be like be positive and so many other things. Support yourself and also seek support with your friends and family. And also, if suppose that is not there, then there are professional helps which are also available. That can, so you can consult your doctor, or you can also consult a psychologist as well.
Okay, ma'am. On the next question, in case of any discrimination at workplace, where should one go for help?
So, as such, right now, there is, I'm not sure whether we have laws for this as such, but yes, HIV, people living with HIV should not be discriminated at work. There are, however, certain professions which do not, they want HIV negative status, but otherwise, most of the professions as such do not really, there should not be discrimination with the HIV in patients or people living with HIV, because there's just 3 important modes of transmission.
Okay, ma'am. Ma'am, the next question is cabotegravir available in India, and what's the dose?
So currently the cabotegravir is available, but however, it is not really being, I have not, it is available, but I have not really used it as such in my clinical practice.
Okay, ma'am. Ma'am, the last question. How does regular exercise, yoga, and physical activity help?
So regular exercises, yoga, and physical activity helps everyone. It helps children to elderly people. It helps me. So it helps because there's scientific basis of it that it releases endorphins. So it's very, very extremely important for your mental health. And I would really suggest people, whenever there is a stress can be combated by, of course, being positive. But once you exercise, just simple yoga, meditation, or even going for a walk for 30 minutes, or even vigorous exercises help in focusing, and they release endorphins and it reduces the stress. So overall, in the very difficult times, to me also, it is one of my the where I actually clutch on.
Okay.
So it should help everybody.
Okay. Okay, ma'am. All right.
And if you can't do a single, alone, if you can't do it, it's okay to go into groups and do them, because when there is depression, when there is stress, going into groups and performing the acts together actually helps.
Yes, sure. That's right, ma'am. Okay, ma'am. So, ma'am, thank you for throwing more light on HIV and aging and also answering all the queries raised by the audiences. So, I would also like to thank all the participants who have attended this webinar and making it a huge success.
Thank you so much.
Thank you once
for
again.
this platform. Thank you so much. And all the very best.
Thank you, ma'am.
Yeah. So thank you, Harisha. Thank you so much.
Yes.
All
Thank you,
the very
ma'am.
best to you and everybody in Hetero Healthcare.